Most people ignore warning signs in their mouth until it's too late. And a small issue can sometimes turn into something much worse, especially if you don't catch it early. So how do you know what's serious and what's not? So today I'll go through 5 things that happen in your mouth that you should not ignore, and what they mean and when you need to take action. And some of these might actually surprise you. So have you ever noticed like a weird metallic taste in your mouth? Maybe it happens randomly, it lingers throughout the day, and a lot of people might shrug it off, but what if it's actually your body trying to tell you something? And your mouth is a complex system. It's trying to always balance between bacteria, pH levels, saliva production, and when something's off, usually one of the first warning signs is that metallic taste. So what could that metallic taste be? One thing could be bleeding gums. So that's one of the most common causes of metallic taste. It's basically your blood mixing with saliva. And if your gums, especially if they bleed easily, if you've got early stage gum disease or even advanced stage of gum disease, that could be a cause. Sometimes even a hidden infection. So if you have like an abscess or a bacteria that's trapped under your gum, your body could be trying to fight off an infection, which can release those byproducts. And sometimes it could be certain health conditions. So in some cases, that metallic taste could be linked with kidney disease, diabetes, even vitamin deficiencies, and especially if it's persistent and if you've been also noticing other symptoms like a dry mouth or fatigue. Now, usually it's not a concern, especially if it happens briefly after having something acidic, because sometimes that could be just your taste buds reacting temporarily, or if you've started a new medication or if you've changed toothpaste, that could sometimes be just the side effect, and that usually fades over time. So here's what you can do about it. If that taste comes and goes, take note of when it happens. Is it after eating? Is it after brushing? Is it throughout the day? Just make sure when that happens, and especially if it happens with gum sensitivity or even a bad breath, then I would try and not ignore that. So take note of that, because that could be your body trying to give you an early warning before things get worse. But it's not just the strange taste that your mouth gives you. Sometimes, you could have a pimple or bump on your gum that keeps coming back. So have you ever run your tongue over your gums, and maybe you felt like a small bump, and then a few days later it disappears, and you probably think it's no big deal, but then especially if it comes back, and this time, it feels fuller, like it's filled with something. And if that's happening to you, then it's not random, and it could be your body trying to tell you something. So what do I mean here? It could be, a recurring gum boil. Almost always signals that it's an abscess. Now that means that there is bacteria trapped inside your teeth and your gums, and your body's trying to push out the infection. So if that's left untreated, that infection doesn't just stay in your gums or your teeth. That can spread to the rest of your body. It can go to your jawbone, it can spread through your bloodstream, and even in some cases, it can even go up to your brain. And if it's painful, swollen, or growing, then that's a red flag. If the area, especially around the bump, feels hot or swollen, that's your immune system trying to fight an active infection. Now, here's when I wouldn't be too concerned about it. So if it happens once and never comes back, it could be just biting your cheek. Or if it's inside your lower lip, usually, sometimes there could be a bump there, and usually that's known as a mucus cyst. And mucus cysts usually are harmless, and a lot of times they heal on their own. Now, not every bump in your mouth is dangerous, but especially if it keeps coming back, if it gets bigger, if it gets worse, painful, then that's a sign that you need to have it checked out. Now, an occasional bump is one thing, but what if an entire tooth starts feeling loose, especially if there was no injury? That's when things get serious. So say you're brushing your teeth, you're eating, and you notice something strange. One of your teeth all of a sudden feel loose. You hope, you check again, you hope it's your imagination, but it turns out that it's not. If a tooth starts feeling loose with no obvious reason, it's usually a sign of something happening beneath the surface. And catching it early can make the difference between saving the tooth and losing the tooth. Now, here's when I would suggest having a further look, because sometimes it could be advanced gum disease, which is known as periodontitis. Now, not all of gum disease is bleeding gums. Sometimes that can lead to bone loss, and that weakens the foundation that's holding the tooth. And once the tooth is loose, bone loss has already happened, and that bone doesn't grow back. Or it could be linked with an undiagnosed medical condition, so diabetes, osteoporosis, autoimmune diseases. These can weaken the structures supporting your teeth, especially if you've noticed things like slow healing, swollen gums, frequent infections. A loose tooth can sometimes be the part of a bigger issue. And I would also try and rule out an abscess that could be weakening the bone. So a deep infection can eat away the bone that's supporting your teeth. And the looseness comes usually with pain, swelling, bad taste in the mouth, and then abscess can sometimes be the cause. Now here's when I wouldn't be concerned. So if you've had recent dental work or braces, slight movement is normal and your teeth can sometimes shift and adjust. Or if you've also bitten down on something hard, the ligaments around your teeth, they can be irritated and that can take a few days to settle. A little movement doesn't mean that your teeth are in danger, but if you've noticed it get progressively worse, or if your gums are inflamed, painful, then it's something worth having looked at. But a loose tooth isn't the only sign that your mouth is trying to warn you. Sometimes that can be a small sore and that could signal more important things. And that brings me to mouth ulcers. So they're common, they sting, they're irritating, and that's normal. But if there's one that sticks around for more than 2 weeks, and if you're unsure whether it's healing or not, then I wouldn't ignore it. And that could be a sign of something serious. So here's when I would be concerned. So if it's a chronic ulcer, that could be a sign of a deeper issue. Persistent sores in your mouth sometimes can be linked with vitamin deficiencies, autoimmune diseases, and mouth cancer. So if it's painful, growing, or has irregular borders, then I suggest having it checked. So sores that don't heal, they keep enlarging, or they have a rough surface, these need a closer look. And painful ulcers that resist treatment, these could indicate that it's more than just irritation. Now here's when I wouldn't be concerned about it. If it's been within a week, then it's usually a canker sore. And if it happens occasionally, but usually disappears, it could sometimes be related with stress, diet, or medication. Most ulcers aren't a concern, but if it's one that isn't healing, then I suggest having it checked. And the earlier you catch the problem, the easier it is to treat. There's one last warning sign most people ignore, and it might be the most serious of them all. And that's usually a white or red patch that doesn't go away. Most people don't check the insides of their mouths regularly, and sometimes that could be the sign of a bigger issue. So if you notice usually a red or white patch and that doesn't go away within 2 weeks, then don't ignore it. It could be harmless, but it's worth paying attention to. If you're checking your mouth, focus on these areas. So check the inside of your cheek. So that's a common spot for irritation, but that could also be where patches develop. Check the sides and the underside of your tongue. That's where more concerning lesions can sometimes develop. The roof of your mouth, so the palate, that's less common, but persistent patches should always be checked. Your gums, so sometimes a red or a white patch or red spot on your gum that doesn't heal, that could also be a sign of more serious things going on. And also the back of your throat. Now that's not as easy to see, but persistent patches should always be checked by a professional. And I'm not saying all red or white patches are bad or dangerous. A lot of them can be related with irritation, but it's the ones that don't go away, the ones that last more than 2 weeks, the ones that are painful, the ones that cause discomfort, the ones that you feel that are getting bigger in size, or especially if you're not sure about them, then I always suggest having them checked out by a dentist. And if you're also wondering about another major sign, which is what happens when a toothache disappears, and that's not a good sign, I suggest you check this video.